Okay, I think we're going to go ahead and get started. Thank you to everyone for your participation today, and welcome. The purpose of this presentation today is to learn about stomach cancer research funding opportunities through the Department of Defense's peer-reviewed cancer research program. I am Camille Vanta, and I serve as a policy and advocacy consultant for Debbie's Dream Foundation Curing Stomach Cancer, which is pleased to be able to bring this timely webinar in partnership with the American Gastroenterological Association. I ask that as we begin the presentation that everyone mute their phones or computers, and I want everyone to know that there'll be an opportunity for questions at the end of the presentation. Next slide. The objectives of today's webinar are to help researchers recognize the role of the peer-reviewed cancer research program in funding stomach cancer research, and to learn about the peer-reviewed cancer research program funding opportunities and strategies for funding success. In a moment, you will be hearing from Donna Kimbark, who is the program manager for the peer-reviewed cancer research program. But first, I just want to say a few words about advocacy efforts to ensure the continued funding for stomach cancer research through this program. Next slide. In 2014, Debbie's Dream Foundation approached members of Congress about including stomach cancer in the program, and advocates made the case for stomach cancer's inclusion, including military relevance and a historic lack of funding for this deadly cancer. That year, Congress included stomach cancer in the program for the first time, and since then, stomach cancer has remained in the program due to ongoing advocacy efforts, and funding for the program has been increasing, providing greater opportunity for researchers than ever before. Next slide. This February, stomach cancer advocates participated in more than 150 virtual meetings with members of Congress and staff. In those meetings, a request was made to include stomach cancer again in the program for fiscal year 2023. Next slide. Debbie's Dream Foundation and stomach cancer research advocates are fortunate to have three incredible congressional champions: Congresswoman Lois Frankel, Congressman Adam Kinzinger, and Senator Mazi Hirono. Again, this year, these three lawmakers are championing the continued inclusion of stomach cancer in the peer-reviewed cancer research program. In fact, a letter with the signatures of 98 House members was just sent to the Appropriations Defense Subcommittee with this request. Next slide. Now it is my pleasure to introduce Dr. Donna Kimbark. Dr. Kimbark received her PhD in molecular pharmacology and cancer therapeutics from the State University of New York at Buffalo, Roswell Park Cancer Division. Following postdoctoral training at Johns Hopkins University, she worked in the biotechnology sector before joining the Congressionally Directed Medical Research Program in 2002 as the science officer for the breast cancer research program. While working in grants management, she received her certificate in epidemiology and biostatistics from Drexel University. And in 2008, Dr. Kimbark became program manager for the Congressionally Directed Medical Research Program. Throughout her years at the CDMRP, Dr. Kimbark has managed research funding programs for autism, multiple sclerosis, cancer, and bone marrow failure syndromes. Currently, she leads the program teams for the peer-reviewed cancer research program and the melanoma research program. Thank you, Dr. Kimbark, for joining us today. I will now turn the presentation over to you.
Thank you so much. It's great to be here today. And I do have an announcement. I'm no longer the program manager for the melanoma research program, which leaves me to actually focus just on the peer-reviewed cancer research program, which is a phenomenal, I believe, for us so that we can really focus down on the peer-reviewed cancer research program. Today, I'm going to talk to you about our funding opportunities in the program as a whole. I'm looking forward to this. So let's go to the next slide. Today, the agenda for the webinar today is I'm going to talk to you a little bit about the history so you can get some grounding for the peer review cancer research program and what the congressional language means. I'm then going to talk to you a little bit about our overarching challenges and how that leads to our program initiatives. Those initiatives including career development, innovation, and convergent science. From there, then I'm going to move into the funding opportunities and what is available today, right now, for you to apply to. And I'm going to give you some tips for success and some pitfalls I've seen others make mistakes. Let's go to the next slide. The history of the peer review cancer research program is shown here. We began in fiscal year 09 with an appropriation of $16 million. We always have congressional language that really signifies what we should be funding in those topic areas, including stomach cancer and other research areas as well. From 09 to 22, we've funded over 35 topic areas across the whole spectrum of cancers throughout the different years. Could be 4, could be 8, could be 20. From fiscal year 09 through 21, we've actually funded about $650 million and 920 awards. And in fiscal year 22, we have our largest appropriation yet at $130 million. And this is what's available for you today. Our vision is to advance mission readiness for those in the U.S. military affected by cancer, but also to improve the quality of life by decreasing the burden of cancer on service members, their families, the veterans, and the American public. How we do this by successfully promoting high-impact cancer research across the whole entire spectrum of cancer research. Let's go to the next slide. The congressional language really has some really good information in it to really guide us as to what we're going to be funding on a yearly basis. As you can see, we have topic areas this year. We have 20 different topic areas, from esophageal cancer to liver cancer to stomach cancer. And stomach cancer is what I'm going to highlight today. The FY22 details that I really want to talk to you about is that there are prohibited cancers. So if you come in with an application that's doing stomach cancer and you're also going to do something in pancreatic cancer, leave the pancreatic cancer out. Pancreatic cancer, breast cancer, prostate cancer, ovarian cancer, kidney, lung, and melanoma, as well as rare cancer, are all considered prohibited cancers. And you're going to ask me, why are they prohibited? It's because of the fact that they have their own standalone programs. Now, rare cancers you could also be applying to as well, as long as it's at a level of less than 6 cases per 100,000. So think about those types of stomach cancer and subtypes of stomach cancer. The inclusion of the rare cancer research program, though, does not prohibit the peer review cancer research program from funding the cancers that might be rare on our list as well. Relevance to service members and their families is required. So let's go to the next slide. When we look at stomach cancer, let's talk a little bit about some general military facts, and that is that service members are deployed to areas of the world where H. pylori is endemic and therefore are at higher risk of developing ulcers as well as stomach cancer. The incidence rates of service members showed lower rates for digestive cancers than the general population, but that doesn't mean that they're not going to develop some of these cancers later on in life. And that's one of the things we have to really look at, is active duty as opposed to long-term effects. And we all know that long-term effects can be something that's really important in cancer development. The veteran access to health care also plays a huge factor as well. Overall health and survival from cancer, including stomach cancer. So what I'm talking about here is that 60% of veterans have some access to the VA system. That means that 40% do not. So that's really important. And do these veterans at 60% actually use the VA healthcare system? Can they get into the system? Is it overburdened? So all of this really does play a part and a role in whether or not these service members are going to be able to be seen and taken care of so that they do not develop stomach cancer. Over the years from FY15 to 21, stomach cancer has gotten 50 awards and a $30 million, almost $31 million investment. I do want to point out that stomach cancer is really a smaller portion of our portfolio. I think it's like around 5% there. If you can see, it's in the brown right up at around 11 o'clock on that pie from FY19 to FY21. We want to expand that. We really want to have more people submitting meritorious stomach cancer applications, and that's why I'm here today. So let's go to the next slide. Some of the things that I want to talk to you about is that congressional language. I talked to you a little bit about the fact that there is relevance to service members and their families. It's really important. And that means that what we're doing here is we're requiring all applications to answer one of our military health focus areas. And the two military health focus areas that we have are environmental and exposure risk factors associated with the military, associated with cancer, excuse me, that the military may actually be at risk for because of their occupation or where they're deployed. You can imagine that being deployed in some of the areas where H. pylori is endemic, it might actually increase your risk. So that's really something we have to pay attention to when we're talking about military health and how it can impact our cancer development. And the gaps in cancer research that may affect mission readiness is our second military health focus area. And when we're talking about mission readiness, we're really talking about cancer diagnosis in service members or their families that may lead to force vulnerabilities. Now, you might think, well, how is cancer specific to the military? Cancer is not specific to the military. Cancer, anybody can get cancer, correct? And one of the things we have to look at, though, is how does cancer affect the military mission itself? If a service member or their family is out on leave or they have to take time off to take care of a family member or something like that, that means that that unit that service member was in is no longer mission ready and therefore leaves gaps in our mission readiness and the whole unit's readiness. So we do have to think about that. And overall, the military health systems is burdened with higher healthcare costs due to cancer diagnosis and treatment. And that's something that we want to be able to really answer and be able to help with the military health system. So let's go to the next slide. When we look at the PRCRP, one of the things I told you I was going to talk about was our overarching challenges. One of the things that people often tell me is that you have a whole group of different cancers. They have all of their own different issues, and there's no way that you can have overarching challenges or that you could have strategic plan. I consider this a challenge, so of course I had to answer it. And so what we did was overarching challenges. We went to a number of subject matter experts and we asked over the swath of different cancers, what were the gaps? So we looked at the gaps and then we distilled them down and found out that there was a lot of commonalities between the different cancers. And these gaps really fall into 6 different categories, from prevention, diagnostics, treatment, behavioral sciences, diversity, and resources. And from that, then, we refined our overarching challenges. Underneath these 6 categories, you will see that there are 14 different overarching challenges. And because these overarching challenges are broad enough for you to actually find somewhere that your study would fit in stomach cancer, we feel that it encompasses all of the different cancers that may now or in the future be part of PRCRP. But at the same time, they're focused enough that it really tells us where our portfolio is answering the needs in cancer capability gaps. You can see that we have behavioral health science developed strategies to address survivorship issues under treatment, transform cancer treatment and advanced immunotherapy. We also have developed preventative strategies and early detection methods. You'd pick one of these in order to answer those cancer capability gaps. So let's go to the next slide. When we look at the next slide, I'm going to go into that strategic plan that everybody told me there's no way I could make. Well, we made a strategic plan, and we think it's really, really great because it's really at the forefront of where cancer research is today. Initially, we have two initiatives. The first initiative is Convergent Science and Career Development. And this really, our linchpin in this is our virtual cancer center, which I'm going to go into in depth in just a minute. And what we're really looking at is Convergent Science. What is Convergent Science? And that is, it's a means of solving vexing research problems. And isn't stomach cancer a vexing research problem? And what it entails is integrating knowledge, methods, and expertise from different disciplines and forming novel frameworks to catalyze scientific discovery and innovation. So we're not forgetting about innovation and scientific discovery, but what we're doing is we're bringing together disciplines differently than multidisciplinary. What we're doing is we're reaching out to physics, we're reaching out to computer science, to life sciences, and bringing them together so that we can tear down the walls that are formed in our Ivy Leagues, right? Our walls of different departments, different organizations within our departments, different lab cores within our departments, and so on. We want to tear them apart, and we want people to be able to cross-pollinate and talk to one another. And the best way to start this is by looking at training. We train our early career investigators in almost a narrow vision. We're not allowing them to use their peripheral vision at all. So the early career investigator, we're developing them to use Convergent Science in order to answer the most vexing problems in stomach cancer these days, as well as bringing them in and including them in understanding military health. Our second initiative is innovation and impact, because part of that definition of Convergent Science is really about scientific discovery and innovation and impact. And our innovation, we want to support innovative and impactful ideas that will enhance clinically relevant ideas to really bring it towards clinical applicability. And then finally, we really want to look at how we could do this in a Convergent Science way. So let's go to the next slide. I'm going to go over our funding opportunities in brief right now, and then I'm going to go over some highlights of each one of them in a moment. And our Convergent Science and our innovation and impact initiatives do kind of overlap, but I'm really going to give you some definitions on how they work out. One of the things that is our linchpin, as I said, was the FY20 Virtual Cancer Center. Now, that FY20 Virtual Cancer Center is not being offered this year, but we are offering the scholar option that will grow that Virtual Cancer Center. So we're really excited about this Career Development Award. Another thing that we're doing for the Convergent Science Initiative is Convergent Science Cancer Consortium Development Award. Here we want to look at established investigators and bring this to the research realm rather than just the training realm. The Innovation and Impact Initiative, here we have our Career Development Award that is at the fellow option. These people might not be as fully independent as the scholar options are. So we're looking for impactful research from them so that they can move forward in their career and become more independent. The IDEA Award, the Impact Award, the Translational Team Science Award, and Behavioral Health Award all look at innovation and impact to some degree. So let's go to the next slide. Okay, let's talk a little bit about the Virtual Cancer Center. I kind of want to ground you here so that when I talk about the Scholarship Award, you'll understand what that is. The Virtual Cancer Center was offered in FY20. And the director is Dr. Dan Theodorescu, and the deputy director is Dr. Peter Kuhn. And what they're doing here is they have developed this Virtual Cancer Center of all of these early career investigators, what we call scholars. And you can see that they are placed all over the country. And also what I also want to point out is that they're each doing their own individual research. And that individual research can be in colorectal cancer, can be in metastatic cancer. We're looking for a stomach cancer scholar, but they're also, not only are they different topic areas, but they're also different disciplines. We have a chemist, we have a geneticist, we have a psychologist. And here we have this peer group that are now tearing down the walls that we usually see in departments and laboratories. We're tearing down those walls. This is a peer group where they can talk across to one another and finally learn how to talk to one another and how to collaborate across this very diverse network. This is what we consider at the forefront of cancer research today, really bringing together those different disciplines, bringing together the different sciences and cancers, and therefore moving the field forward with convergent science. Let's go to the next slide. Okay, now we're going to talk a little bit about those funding opportunities that I know that's where you really want to know, what you really want to know about. When we talk about our funding opportunities, we talk about the Virtual Cancer Center Scholar option. Okay, I just told you a little bit about it, and we want to grow it. In order to do any of these career development awards, you will do a letter of intent. And that letter of intent means that you're just going to say, I'm going to apply to the scholar option of the Career Development Award, and I'm going to apply under stomach cancer. You don't have to wait for an invitation, okay? We just have to submit that letter of intent, and then you go right ahead and start writing that full application. Go right ahead and do it. That full application for the scholar option is $800K over a 4-year period. It's fully independent, tenure track assistant professor or equivalent. Now, I want to talk to you a little bit about what that means. Fully independent means you have your own laboratory. Not that you have your own laboratory space, but you have your own laboratory. So you have your own laboratory, and if you're within 7 years of your terminal degree. Now, there are some caveats to that 7 years terminal degree. You don't have to count time in residence or clinical fellowship. And you don't have to count time for medical, family medical leave, like you're on maternity leave or you're ill from COVID. We also are making an exception this year for any hiring freezes that happen that cause you to lapse out of that 7 years due to the pandemic. So we are taking into account those things. And here the scholarship option is really supporting the addition of the scholars to the Virtual Cancer Center to provide that unique national networking, the peer group for junior faculty, and really learning about convergent science. Both Dan and Peter, our director and deputy director, are experts in convergent science and really can bring together this crazy group of people that are from different disciplines and different topic areas, and we're very excited about that. So this would be you must address a topic area, a military health focus area, and an overarching challenge, which I'm sure you can easily do. Now, the fellow option is slightly different. This is $400K over 3 years. You will not be associated with the Virtual Cancer Center at this time. What you really are is you're an independent investigator, but you might not have your own laboratory itself. You might have space in someone else's laboratory. So if you have space in someone else's laboratory, you're not a postdoc, but you are a research assistant professor or an instructor. That 7-year terminal degree still comes in play, and so do all of those caveats. But you really just need a little bit more support to get you to that independence. And this is where the fellow option comes in. We're really trying to further your independence to conduct impactful research with the mentorship or career guidance of an experienced cancer researcher. Once again, you're going to answer the topic area, the military health focus area, and the overarching challenges. Let's go to the next slide. I told you that the first initiative really had to do with convergence, and that scholarship option was part of that convergent science, but so is the Convergent Science Cancer Consortium Development Award. This is a brand new award mechanism. It is separate from the Virtual Cancer Center and the Scholar. This is a letter of intent. Once again, no invitation is needed. But what is this Consortium Development Award? Well, what we are doing here is it's a $2.5 million award over a 2-year period of performance. Not very long, right? We're looking for a consortium director that will put together a coordinating center and some co-PIs for research sites. Now you look at that bubble on the left-hand side, and you'll notice in that bubble it says topic area 1, topic area 2, and topic area 3. That means what we're really looking for here is we're looking for somebody to come in as the consortium director. That would be, for instance, that research site will be looking at stomach cancer. But research site number 2 might be looking at liver cancer. Research site number 3 might be looking at metastatic cancer. And all together, you're going to address these different cancers with different disciplines, and therefore you're going to support the novel approaches to ending cancer. Now, how does convergent science come to this, and how do you unify all of these different cancers that you might have? Now, remember, this is a development award, and we're going to eventually go into what we call our consortium award in fiscal year 24, hopefully. And what we're looking for is developing this consortium. So we're going to grow it, and we're going to do a proof of principle. What we believe is at the forefront of cancer research is convergent science. So what we're asking you to do is a proof of principle. Does convergent science work in answering the vexing problems of stomach cancer today and some other cancers as well? How do you unify all of these different cancers? Say your coordinating site is stomach cancer, but one of your other research sites just happens to be your buddy that you used to know back in grad school, and he happens to be looking at brain cancer. Okay, I'm just throwing something out there. How are you going to unify it all? You're going to address one overarching challenge. That means all of the center and the different research sites are all going to look at one overarching challenge. Okay, maybe transforming cancer treatment. So you're going to transform cancer treatment for stomach cancer, for brain cancer, for metastatic cancer. So you're going to learn from one another. And maybe one of you is a biochemist, one is a big data science and computer science person, and another person happens to be a molecular biologist. You're all going to wrap this together, okay? And you're going to put together a proof of principle convergent science research project. But I want to point out to you is that this is a 2-year period of performance. So those research projects are going to be fairly small. A lot of this is going to be on the emphasis on the development of the Convergent Science Consortium infrastructure. We're asking you to put together the infrastructure, the advisory board, the steering committee, and so on, so that you will have the means to put together a consortium in fiscal year 24. And so you do have to answer at least 3 topic areas, 1 overarching challenge, and of course, a military health focus area. Let's go to the next slide. So some of the other letter of intent funding opportunities are shown here. The Behavioral Health Science Award, I think, is one of the ones that is near and dear to my heart, because it's one of the areas that I think is forgotten very often when we talk about cancer research. And we all talk about wet science, wet lab science a lot, but we don't really talk about psychological sciences as much as we should. So the Behavioral Health Science Award is really focused on that. It's a $1 million in direct costs over a 4-year period of performance. Independent investigators at a faculty level appointment or equivalent are eligible. And what we're really looking for here is to help the survivorship and quality of life of people that have been touched by cancer in one way or another. Perhaps it is, some of their long-term issues that they have, even issues that they have during cancer treatments, and so on. So we're really looking to deal with quality of life and survivorship and psychosocial research that is related to short and long-term effects of having cancer and the treatment that follows. We are allowing pilot clinical trials here, but you do have to have preliminary data for those pilot clinical trials. You will answer the topic areas and the military health focus areas. We do have a limited number of overarching challenges for the behavioral health science, and you'll find that more in the funding opportunity itself. For the Translational Team Science Award, this is our largest award that's focused solely on research, and it's a $2.5 million in direct costs over a 4-year period. And it is at least 2 to 3 PIs coming together at the assistant professor or equivalent. And what we're really looking for is those translational studies that will be associated with an ongoing or a completed clinical trial. As you know, a lot of the funds that go into clinical trials are just for the clinical trial itself. You accumulate all this data, but you don't have enough funds to actually study the data. The correlative studies are kind of left on the side, right? So what we want to do here is we want to fund those correlative studies. That's what we're trying to do. Clinical trials are allowed here. Funding for the clinical trials are allowed if you have an ongoing trial, but the correlative studies is really where the focus is here. We are looking for preliminary data, of course, for this one, since it's more mature. And all of the topic areas, focus areas, and overarching challenges are eligible for the Translational Team Science Award. Let's go to the next slide. Now, I changed the visual on this slide mainly because of the fact that we have now entered into the area of pre-proposal and invitation required. Sorry about that. We have two different award mechanisms, the IDEA Award and the Impact Award. You must write a pre-proposal for the IDEA Award and the Impact Award, and you must be invited to submit a full application in order to submit a full application. The IDEA Award is a one-page pre-proposal. It's $400K of direct costs over a 2-year period. If you applied previously last year, you might notice that there is some decrease in the amount. Last year was $500K over a 3-year period. We decided to make it more per year and close down the year. So it's $400K over a 2-year period. We believe that the IDEA Award is really about basic research and generating that preliminary data. You have an out there idea, go ahead and submit it to the IDEA Award. We're not looking for preliminary data. If you do submit preliminary data, it will be evaluated. Here we're really trying to support innovative, high impact, high risk, high gain type of award studies. And what we really want to know, I really want to tell you here is that if you had something, a project in your laboratory that's been going on for 5-10 years, it's not appropriate for the IDEA Award. This is for ideas that you have percolating in the back of your mind that you really want to do, but you haven't had a chance to. These are for basic type of studies. Independent investigators at the faculty level appointment are eligible. And you can apply to stomach cancer, military health focus area, and an overarching challenge. Finally, the Impact Award is a 2-page pre-proposal. You will have to wait for an invitation to apply for the full application. It's a $1 million for direct costs over a 3-year period of performance. Here we're looking at investigators at the assistant professor or above, and our equivalent are eligible. And what we're really looking for here is to separate this out from the IDEA Award. This is not about innovation per se. What it's really about is impactful near-term research. We're looking for that mature research that needs more funding to move on to clinical applicability. So that's where the Impact Award is. Make sure not to mix these two up. If you're pushing something that's very basic in the Impact Award, it's probably not going to get funded. But if you're pushing something in the IDEA Award that is just an incremental advance, it's been in your laboratory for quite some time, not going to get funded. The Impact Award is really about clinical applicability and seeing near-term major impact. That's why it's called Impact. The clinical trials are allowed here, and you must address the topic areas, the military health focus areas, and the overarching challenges. So let's go to the next slide. Okay, this is something that you really have to go through. I'm going to go through the first 4 funding opportunities. That's the military, that's the behavioral health science, the Career Development Scholar and Fellow, as well as the Translational Team Science Award. All of those are letter of intents, where you just have to say, I'm going to apply, and this is my topic area, and that's it, okay? You can start writing today and just keep on going, but you have to make sure that your letter of intent is in by July 12th, okay? And you will be submitting that to our EBRAP portal. It's ebrap.org. You'll submit that to our portal by 12 July, 5 p.m. Eastern time. Okay. You do not have to wait for an invitation to submit. Your full application, though, is due on the 2nd of August. and it's due at grants.gov. And you must submit it by the 2nd of August. Excuse me. Sorry about that. After that period of time, when you submit by the 2nd of August to grants.gov, you will have a period of time, about 7 days, to go to our eBRAT portal and take a look at what has been submitted to grants.gov, and make sure that you've submitted the right career development award, or the right bio sketch that explains that you are on maternity leave or something like that. All of this should be the correct ones. So you should be able to do this within the verification period. The Convergent Science Cancer Consortium Development Award is the last letter of intent. It is due on the 17th at ebrat.org of August. You do not have to wait for a letter of invitation. You just have to go ahead and write and submit your full application to grants.gov by 7 September. The verification period for this one ends on the 14th of September, so make sure all your I's are dotted and your T's are crossed during that verification period. And the last two are the Idea Award and the Impact Award. Here is where you have to put together a pre-proposal and wait for your invitation to submit. It's off to the races because these are due on May 25th at 5 p.m. So put together those pre-proposals, do it now, and submit them now. The invitation to submit a full application will come to you through the eBRAT portal on 11 July. After 11 July, then you'll have until the 7th of September to submit your full application to grants.gov. And then you have until the 14th to verify everything is in its place and where it should be, and the most up-to-date version. Let's go to the next slide. Some strategies for success that I like to talk about is the deadlines are important. Now you're going to say, I didn't memorize all those deadlines. What am I going to do? Don't worry about that. The deadlines are right on the front cover of the program announcement. So you can find them right there. Don't worry about it. And bring your team together right now. Start calling them up, start emailing them, get them together. Make sure that you clearly define your team's skills in the application. We shouldn't be, chasing around and trying to figure out what your team is doing, and justify how and why they can achieve the anticipated outcomes that you are hypothesizing that you'll be able to get. And then also forget the jargon. Don't tire the reviewers. You don't want a reviewer sitting there saying, I tried to read this sentence 15 times and I really couldn't figure it out. I couldn't figure out what they were trying to do because they had so much jargon. They had so many abbreviations. So make sure that your reviewer says something like, wow, this was a pleasure to read. That's what you want to hear. Review your documents prior to submission. Like I said, the verification period is really important. And also while you're putting together your application package, a lot of people spend most of their time looking at the award intent. Thank you. Do go ahead and do that. And looking at the application requirements. Thank you. Go ahead and do that. But keep on going to the back of the program announcement and look at the peer review criteria. Because the peer review criteria, the peer reviewers go through that criteria and check off whether or not you have that. And if you don't have something in there like an alternate strategy or something like that, they're going to say that's a weakness. Make sure that your aims are related, but they don't interweave. Because if one falls apart, they're all going to fall apart. You don't want that. So pay attention to these strategies for success. I also like to tell people that you should put the bottom line up front. Okay, tell us what your idea is and then back it up. Don't spend a lot of time beating around the bush. I mean, this is not writing fiction, okay? You want to go ahead and give us the bottom line up front so we know what you're trying to do. Make sure that your research aligns with the intent of the mechanism. We are judging you on that this year. So it's really important for you to pay attention to that. If you're going to the Idea Award, it really should be about innovation, high risk, high gain, not the next thing that you're doing in your research. If you're going for the Impact Award, that's much more about mature science. I really like to say cool science is good, but impactful science is great. Remember, we're here for the patients, and that is the most important part of this. The patients are our true north, and that's what we're trying to do. We're trying to make science great for the patients, and that's impactful science. And I want to tell you to use plain language. You will be evaluated on this in the lay abstract and the impact statement. Those two portions should be plain language and should be very, very lay friendly. We as scientists must learn how to speak to the lay population. And we're asking you to do that in the lay abstract and the impact statement, because patient advocates will be there. Patients that have the disease will be there to judge and look at this and evaluate this. Let's go to the next slide. Some pitfalls to avoid during submission, which you can see on the right-hand side of this slide, is our panel members, our programmatic panel members, our subject matter experts. Please do not have them in your application. They should not be collaborators. They should not be one of the research site co-PIs. They should not be your career guide. They should not be any of this, okay? They can be someone that you're collaborating with currently on another award. That's fine. We'll just recuse them during the review of your application. This application should not have any of these people on it. Do not exceed the page limits. I know this seems pretty trivial, but please check your files when you're creating your PDF version to make sure it doesn't pop over a couple of sentences. And make sure that those submission deadlines are followed. Grants.gov takes up to 72 hours to validate. We have no control over Grants.gov. That's a federal-wide system. We don't control it. We don't manage it. So that means that your verification period is 7 days. 3 of those days are going to be eaten up by Grants.gov validation, that you won't be able to access your application via eBRAP to see whether or not you put in that correct biosketch. So pay attention to that. So really do use that verification period and possibly put in your application before the submission deadline. And also, the one thing that you cannot change during the verification period is the project narrative and the budget. You cannot change those two things. Once you submit them, it's a done deal. If you submit them prior to the deadline, you can resubmit, and the old ones go away and the new ones are there. But after that deadline, that grants.gov deadline, it's done. Okay, so pay attention to that. Pay attention that you have the right version. Work with your business official. That's a person that's part of your team, the business official. Let's go to the next slide. These are some common questions that I get asked. I'm not from the US, or you have a collaborator that's not from the US. Can this person still apply? Yes. They will need to register with SAM, and all of what SAM is and everything like that is in the general application instructions, which is a companion document to the program announcement or funding opportunity. Go in there and you'll find out more information. When are the due dates? Of course, right on that front cover of the program announcement or funding opportunity, you'll find the due dates and you can plan accordingly. Can a postdoc apply to the Career Development Award? Unfortunately, no. The Career Development Award, the Scholar and the Fellow option, both have a degree of independence that are required. A research assistant professor or instructor can apply for the fellow option. Do I have to use a military population in studies? No, you do not. That's not necessary. You can use a population that is representative. I cannot help you collaborate with military research centers, but I can tell you to pay attention to what those military research centers are. Walter Reed Medical Center, the United Services University. All of those are really good areas to start your search in if you want to interact with the military population or any of the VA researchers and affiliates. You can reach out to them as well. Where do you apply? You start your application at ebrap.org. Just put eBRAP in, or you can start with CDMRP. You can put CDMRP into a browser and you're good to go. If you can find this funding opportunities on CDMRP or grants.gov, on grants.gov, go ahead and use that listing number 12.420 and it will pop right up. And can you get a copy of this briefing? I've sent a copy of this briefing to Debbie's Dream Foundation in a PDF form. So yes, you can go ahead and get a copy of this briefing. Next slide. For more information about the Peer Review Cancer Research Program, please visit our page. And also, if you really want an in-depth view of how to apply to the Department of Defense, you can go ahead and look at our webinar series. It goes through the nitty-gritty of it that I surely don't have time to do here today, but you can go into the nitty-gritty of how we do these things. So thank you very much for your attention, and I'll take any questions now.
Thank you, Donna. That was absolutely fantastic. I hope everyone found that really informative. A copy of your presentation will also be given to staff over at AGA, so they will have it as well to share with anyone that requests it. There's a couple ways that we can handle the Q&A. You can raise your hand and ask a question. We can call on you, or you can put a question in the chat box. Certainly don't be shy. You've got Donna here at your disposal. So please take advantage of it. And while you're thinking of your questions, I want to underscore one thing, and that is that, as Donna said, the program, the Peer Review Cancer Research Program, has $130 million in it for FY 2022. That's the highest level that the program has ever been funded at. And so I think when you look at the funding over years, you see that there is a real commitment from folks on the Hill to continue funding, and not only continue funding, but increasing funding for this program to allow for opportunity from year to year. So I see there are some questions here. The first question, Donna, is will a resubmission, be directed to the similar reviewers?
Okay, so that's an interesting question. Resubmissions, we don't actually allow resubmissions. We allow you to apply, and you can apply with the same research project. And I suggest that you take your summary statement and really look at those weaknesses and try to answer those weaknesses in a rewrite of your application. And it will, all of our peer review panels are slightly different than what you see in study sections for the NIH or the NCI. We have our study sections are specific for stomach cancer. You'll only be looking at stomach cancer on that panel. We recruit new reviewers every single year. There'll be one or two reviewers that are the same, but we recruit new reviewers every single year. So I cannot tell you that they will be exactly the same, and they probably will not be. That's what I have to say. You probably will not get the same reviewers themselves, but you will get experts in stomach cancer. I noticed the next question is, the person asked, Natasha asked, I noticed allocation to liver cancer was 7% over the past few years. Will this stay the same or change? It can change. I don't know what it will be, because we don't portion out our portfolio like that. We don't say we're going to give 5% to stomach cancer, 7% to this, 10% to that. We don't do that. It really all depends on the receipt and then how meritorious each one of the applications are. We try to balance as much as possible, but it makes it very difficult if we don't get the applications in. It really makes it difficult for us to make sure that we're actually getting funding for stomach cancer or liver cancer, for instance. So it will change. But it really depends on receipt and what we're going to move forward with as far as meritoriousness. We do have another one from Dr. Mata, I think your last name is. I'm sorry if I'm screwing that up. I have two questions about the Translational Team Science Award. Can a PI who is being promoted to assistant from assistant to associates be still assistant at the time of application apply for this? You can be assistant or high or above. Okay, when you look at the program announcement, it gets in more detail of the eligibility. So you can be an assistant or above. So yes, you can be an assistant at the time of application and apply for this. Can a full professor, an associate professor, be on the award application, although not a PI? Yes, absolutely. They can. They can be collaborators or co-PIs. Absolutely. Go right ahead and apply. Dr. Katz says, in the pre-application, is the pre-proposal narrative typically written similar to a specific aims page? Close, but what we actually have in the pre-proposal is I have specifically written out what I want you to put in there. From the specific aims to your intent and what is your overarching challenge. So it's a guide right in the program announcement. It'll tell you what exactly to write, but it's close to the specific aims page. Those are all the questions right now in the chat. Are there any other questions?
Those were all great questions. And thank you, Donna, for taking the time to answer them. Oh, here's another one.
Will an excellent score 1.0 get funded? That's a very interesting and dicey question. Okay, so 1.0. Okay, so that means that you have outstanding, no weaknesses. You have a perfect score. Okay, essentially. And I can tell you that the chances of it getting funded are very high. But is it a guarantee? No. And the reason for that is, say I have a 1.0 in blood cancer. Okay. And I funded already a whole bunch of different ones in blood cancer already, and similar awards I funded in previous years. Okay. But I have this other one over here, a stomach cancer one, that scored a 1.8. So it has some weaknesses, but I haven't funded enough in stomach cancer. I might choose that 1.8 to balance out my portfolio than that 1.0. Okay. And that is how we work, because we don't have a cutoff. Okay. We really try to balance out that portfolio, and we try to make it as fair as possible. Although a 1.0 has a very high likelihood of being funded, it's not a guarantee. Who reviews the pre-application submissions? Our peer review, our programmatic panel, you know that slide I had with the pitfalls on it and had that programmatic panel on the right-hand side of it? That's our main group. We also bring in some ad hocs to do some of the pre-application submissions because we have so many. We don't have enough people on our panel. So we bring in some more subject matter experts to do that review for us. Welcome.
Well, I think, Donna, the long and short is that I think that the peer review cancer research program funding opportunities remains one of the best kept secrets in the research community. And so lots of opportunity there for sure. And I hope those of you who participated today will also share this with your colleagues and encourage them to apply as well. If, even if, their cancer isn't in the peer review cancer research program, maybe it'll fall under the rare cancer program or one of the other cancer programs. So, get the word out, share this with your colleagues. The best way that we can continue to fight for funding for this program and increased funding for this program is to show demand for the dollars. And if we can show that the demand is there, then we can really fight for increased levels in funding. And so that's really important. Looks like there's another question here.
Yes, is there a way
Donna,
to get connected with the PO at the DOD, the program officer? I'm actually am the program officer. We just call ourselves program managers. So you can definitely contact W's Dream Foundation, and they can send me your contact information, and I can once I get that sent to me, I usually reach out.
Yeah, thanks. And if not Debbie Stream, you can reach out to staff at AGA, whoever you're in contact with the most, and we'll make sure that Donna gets your contact information. And again, we'll make sure that everyone has a copy of these slides. The recording will be made available. It will be posted. So if you want to listen to it again, or as I said, share it with your colleagues, it will be available. And there are so many resources on the CDMRP website, and specifically the Peer Review Cancer Research Program website. There are a ton of resources. So I encourage you to go to those pages.
And don't forget that the Rare Cancer Research Program is also offering some funding opportunities that might be useful for you to take a look at as well.
Yeah, thanks for emphasizing that, Donna.
Welcome.
All right. Well, we're going to conclude the webinar. Thank you all very much for taking the time to participate. Again, thank you so much, Donna. This was very fantastic and very thorough. We really appreciate your leadership in taking the time.
I hope that everyone applies, and good luck to everyone. I really hope, I really wish you the best.
Thank you. And thank you again to our partner, AGA, for helping to promote the webinar. We really appreciate your partnership. Thank you, and everyone have a good weekend.
Thank you. Bye.